Health Tunnel, one app for all your healthcare needs.
Hi, welcome to another brand new episode of Vital Vibes. I'm your host and your favorite host, Vijay Subbu. Today, we have with us Dr. Krishna Murthy sir. He is an expert in critical care medicine and anesthesia, and is also a general physician and owns Aryan multi-speciality hospitals. Today, we will be deep diving into various questions that the general public have with respect to their profession, lifestyle, and also we will be deep diving into meditation, yoga, and spirituality. So, without much further delay, let's welcome Dr. Krishna Murthy sir onto the show. Hi sir, good morning, welcome to the show. So, first of all, thanks for taking some time off your busy schedule and walking into our studio for this podcast. So, how's Bangalore summer treating you, sir?
Bangalore summer is very hot, prickly heat, and exhausting.
Exhausting.
Added with the traffic.
Both of them make the Bangalore lifestyle hectic. So, yes, sir. So, the first question which I want to start off is very big question mark in the eye of a general public. Usually out of 8 cases out of 10, if the husband is a doctor, the wife will also be a doctor. The daughter or the son will also be a doctor. The son-in-law or daughter-in-law will also be a doctor. And the generation continues. Why and how?
See, the generation of doctors, it is their own, it's only to continue their own legacy. A person becomes a doctor, he prefers a wife to be a doctor because she would understand his night duties, his daily schedules, surgical, and his temper tantrums. Whereas to continue his legacy, it's a human tendency. So I've done it, my children should betterment it. So that's the way, but nowadays things are changing. The stress, the people's stress, hospital running is a risky thing. Usually doctors don't prefer their children to get into this very stressful schedule because you have 15 years of learning and till your age of 30 you have to depend on your parents for your pocket money, and once you come out as some specialist, you'll be 30 plus.
Oh, okay.
So people now, they don't prefer. It's like this era, and it's like a fast food. Like people want things to be done fast. So there is also a comparative logistics when parents start comparing their children with other children. So things are changing, but this is not a static thing. It
keeps on changing. Okay, so based on that, in future, can we see a doctor getting married to an engineer?
Definitely. 100%.
We are on a safer side. Yes, there is some chance. Okay, so and one more compliment, sir. All the girls who are studying medical, as far as I've seen, they're so beautiful. You cannot deny that. They're looking gorgeous. And I don't know how. Every girl who is studying medicine, they look gorgeous.
Maybe you should take it in a very lighter way. So the people who study medicine always stay indoors. So there is no melanin from the sun. They don't get dark. They may look good.
Okay.
On a physical aspect.
Got it, sir. So yes, now continuing to our topic, sir. Usually general public, we have few questions with respect to your lifestyle and the way you look at life and health. First and foremost thing, do doctors actually eat junk food, and do they actually feel the guilt after eating junk food? And also, do doctors have that inbuilt scanner in them? Whenever they see some food, they'll be like, 250 calories, 500 calories, 750 calories. Does that happen?
Like each person is different and a unique person. So maybe he's a doctor or an artist. They have that inner cravings, that inner child. Nobody goes and scans unless you are very more oriented towards how do you look. how do you like somebody from artistic industry? But usually doctors, maybe a person like me at my age, I may think of cutting down all these calories and also scanning. But usually everybody prefers what they like. So I'm like the trend is changing. People are now very conscious. They're health oriented. They hit gyms. They calculate the calories. But generally, I don't see like people check the calories. They eat. They may have the guilt feeling when somebody starts telling about their physical attributes. But generally, they overeat more than the normal person.
Okay. Do doctors party, sir?
They party more. And according to the recent studies, there are like the alcohol drinkers are more in a doctor community when compared to a general population.
Okay. Why? Why is that?
It's maybe the stress factor. One is stress factor, and also that assumption. Okay, I know how to manage this. So this may be one thing. And few people like surgical fields, orthopedicians or intensivists, they're more stressed. They may go for alcoholism, like it. But having an alcohol, not having an alcohol is something which is inbuilt. Like, what do you want? So each person is not like that, but the general thing is like this. So stress, the main contributing factor for more increase in the alcohol consumption.
Okay. Now coming down to more of your profession, sir. As a doctor, you will be having a different lifestyle altogether, apart from the general public. So, can you introduce us to the doctor's lifestyle?
See, doctor's lifestyle. See, whenever somebody wants to become a doctor, from the childhood they will have that notion like have to serve somebody, take their pain, comfort them. So this is one set of doctors. And there is also doctors who want to be very precise, surgical, do dharma, all those things. So basically, like, it all depends on the branches. So few branches, surgical, intensive care, anesthesia, orthopedics, are very, very, very tiring. Cardiothoracic especially. So they are very, very tiring. So you hit the OT very early in the morning, you get tired, you eat there only, there will be no physical exercise. The only thing is your main thing is to save somebody's life, because everybody in a doctor's profession wants to save somebody or make him comfortable, get him out of pain. So those things keep on running in the head. So the timings of food, timings of family outing, everything becomes haphazard. So when you become a doctor, you have to sacrifice your personal life. That's the But there are branches where you are very comfortable, non-clinical branches, and also some branches where you have some time. So it all depends on personal preferences.
Okay, got it. Sir, now speaking of another, not so explored topic on podcast, that is anesthesia. Since we spoke about anesthesia, so for a common general public, can you please explain us how anesthesia actually works, and was this anesthesia present way long back? If it wasn't present way long back, how would the operations go on?
See, the word anesthesia means loss of feeling or awareness to the present environment by a process of drugs, can be injectable drugs, inhalational drugs, to prepare somebody before a surgical procedure. So that's the anesthesia. There are different kinds of anesthesia. One is regional anesthesia, one is local anesthesia, and other one is general anesthesia. So general anesthesia as such, for a common man to understand, it's like flying a aircraft. So first you fuel it. So there are three phases of general anesthesia. One is induction. second one is relaxation, third is maintenance, and fourth is reversal.
There's a reversal to it. Also.
Reversal to it.
Oh,
so,
okay.
So you bring out reversing the drugs. So first the induction is like the fueling where the aeroplane starts. Then the relaxation, it's filled, it starts moving.
Okay.
So there is one part where it takes off.
Okay.
So that's the induction. You go into the state of anesthesia, means loss of awareness.
Okay.
It is induced by few drugs like IV anesthetics and inhalational anesthetics. The main there is an endotracheal tube for protection of the airway, where through which we give general anesthesia, that is the inhalational agents. So the maintenance is by oxygen. Then there is something called as nitrous oxide, inhalational anesthetics, then muscle relaxants. So once the surgery is over, this is the maintenance is like flying a craft, like it's in that state. Midway. So when you want to land it down, so when the surgical procedure is done, so first you cut down the inhalation agents, then you reverse the effects of the muscle relaxants with certain other drugs.
Okay.
So that is the whole process of anesthesia: induction, relaxation, intubation, maintenance, and reversal.
Okay.
Then you shift to the post-operative ward after you remove the endotracheal tube.
Okay. So what happens if we don't reverse it?
What happens? We don't reverse it. See, modern anesthetic drugs. Usually you ventilate the patient. So you put an endotracheal tube. So you ventilate the patient. You don't reverse. So you cut down all the anesthetic agents.
Okay.
So there is an half-life for every drug.
Okay.
So once it comes out of the body, so the modern muscle relaxants act to certain point of time.
Okay.
So when the effect is gone, the patient becomes conscious.
Okay.
So but till that time, you need to put them on artificial ventilation.
Okay, sir. Got it. Just before we proceed to the next question, sir, I have one last question with respect to anesthesia. Has it ever happened in the medical field that in the midway of an operation, the efficiency or the effect of anesthesia gets lower and the patient wakes up all of a
Yeah, that's one big topic as such. This is called as awareness under anesthesia. So you have induced the patient, you have made him sleep, then there is loss of pain, loss of awareness. So there is you maintain on muscle relaxants and inhalation agents. So the patient wakes up, so he becomes aware. See, that is when the effect of the drug decreases. So there are multiple electronic things now where there is something called as ETCO2 and monitors which tells us whether the patient is awake, whether he is in that plane. So you have to supplement with another small dose of the requiring drugs.
Okay, got it, sir. So now, speaking of stressful lifestyle of doctors, how do you cope up with the stress?
Coping up with stress is similar to any normal human being. One is you go in for a physical exercise, you do exercise, or you go in for asanas, yoga, or you dwell inside yourself meditation. So each person's circuit inside the circuit prefers something. So somebody who's very athletic, they hit the gym 1 hour, 2 hours, they feel good. See, this is totally dopamine effects. So somebody feels good with the meditation, and some feel good. So we usually make up our time for any one of these. I usually prefer more of meditation and hitting the gym.
Okay, so you're also spiritual, by the way.
A kind of spiritual.
Okay.
Yes.
What, according to you, is spirituality?
See, the spirituality, there is 3 things in it. One, the spirituality, people often mistake with divinity and religion. See, spiritual is being yourself. Means understanding the connection between the mind, body, and the soul. So divinity is like that which when you have the better connection, you are projected, or somebody sees you, they see something, some kind of an aura.
Okay.
So that's divine, and religion is one thing which human beings have brought in.
So we often hear from our elders that pregnant women should consume a lot of spiritual thoughts. They should read something spiritual, and they should ultimately, stay in touch with some form of spirituality when they are conceived. Does it actually help?
Yes, actually, pregnancy is one of a very miraculous process, which is less understood by us. One thing is, so you are bringing one life through your life.
Okay.
So it is two joy. One is motherhood, other one is childbirth.
Yeah.
So how calm you are, how comfortable you are, how to enjoy this process. This is more comfortable when you are in touch with the higher self. So the higher self can be spiritual, books, can be bhajans, can be reading, or some there are a few techniques, lames techniques, which are introduced in pregnancy. It's a kind of yoga, relaxation techniques. So this is to connect with the higher self. So this will make you calm and make the whole process enjoyable.
Got it. So I have one last question before I call upon our nutritionist expert Apurva. So she'll also be shooting few questions to you. So my last question for the day is, speaking of medical miracles, we often keep hearing a lot of medical miracles happening around us. So I'm sure that you must also have experienced many medical miracles. So if you could share any one medical miracle in your journey, which one would it be?
Yeah, see, miracle is something which your mind cannot comprehend.
Yeah.
So there is you feel like something you comprehend in your way, something comes back in another way. So they have since I work more in an intensive cares, we see a lot of patients who are into near cardiac arrest. We shock them. We shock them the pulses, they go, and we revive the patients. So we do it according to the ACLS protocols. So these process, when we see these process, somebody is you start thinking is it a body or something else? If somebody is talking comfortably, suddenly has an heart attack, he collapses, you go resuscitate, then some people do come back, some they don't. I've seen many cases, this is my journey, as an intensivist into critical care, I see a lot of patients who they are in they are brought in a post cardiac resuscitation state. Some do recover. We have sometimes asked them what was the plane of thoughts you were undergoing, but nobody is able to tell it. But this is one of the daily miracles I see. Okay. So somebody who is coming out from a post cardiac arrest status, or somebody who suddenly succumbs, we revive, and it gives a immense pleasure of that's being a doctor. So that's one the daily miracle I see every day.
Okay, got it, sir. So I have one more last follow-up question for this. Medicine or medical field is corely based on science.
Yes.
Do doctors actually believe in afterlife?
Afterlife. See, thing is, I cannot tell somebody else's experience.
Okay.
I can tell my experience.
Yes, please. Yes.
So see, afterlife, it is the concept which comes with you, with your environmental attachments and how you are brought up, what kind of religious things you practice. See, afterlife. See, somebody is more interested in afterlife means he wants to continue. See, a human being is so selfish that he wants to continue to years and years and years. The concept of afterlife comes here. See, if Dr. Krishna Murthy, he wants to live another 20 years or 100 years next. So I want something of me to be there. So that's how this afterlife concept started.
Okay.
So one thing, but thing is, there are some things which our mind cannot comprehend. I've seen so many like after cardiac arrest, when people like they don't come back, they are declared dead. And usually I read a lot of scriptures. So they tell like the soul stays in the this one like windows and all this thing. So I've searched so many, but my normal eyes cannot comprehend it.
Yeah.
So when we cannot comprehend it, it's not, you cannot say it's false. There is another dimension which we have to understand.
Okay, got it, sir. So thank you so much for like spreading your light on various topics which we as a general public had. So just before I go, I'm gonna shoot 10 rapid fire questions, sir.
Okay.
Are you ready?
Sir.
Okay. First thing, dark chocolate or milk chocolate?
Dark chocolate.
Yoga or meditation?
Meditation.
Cardio or strength training?
Strength training.
Strength training. Okay. Spiritual or religious?
Spiritual.
Okay. Silence or chanting?
Silence.
Silence. Okay. Whole egg or egg white?
Egg white 4 days.
Uh-huh.
Whole egg 3 days.
Got it. Okay. Your favorite cheat meal?
Chicky.
Chicky. Ah, okay. Cheap and best. 5 rupees में cheat meal हो गया.
Yes.
Done. Okay. Stethoscope or thermometer?
Stethoscope always.
Yeah. One last question. Sambar dip or separate?
Somebody.
Dip. Yes, sir. Thank you so much. Now I'll be inviting nutritionist Apurva. So she'll be taking over. Thank you so much, sir. Wonderful talking to you. Thank you.
Health Tunnel, one app for all your healthcare needs.